My name is Christine Robinson and I work for the Community Care and Assessment Unit of the Department of Health and Human Services. And today my presentation will just cover the department's role, being the Department of Health and Human Services and the Department of Health, the Australian Department of Health, our role in organising and establishing the Victorian Community Care Education and Training Service. So what is this service? It's a jointly funded Australian Government, a Department of Health and Victorian Government Department of Health and Human Services project. It aims to provide strategically directed and coordinated education and training to support the community care workforce. And by supporting the community care workforce, we're supporting the gamut from the direct care workers through to professionals, meaning nurses and allied health professionals. Swinburne University of Technology were contracted to plan, promote and deliver this service, and this service commenced in September this year, so it has been running now for nearly 3 months. And training will occur until June 2019, so I stress the importance of really enrolling to undertake this training, as we only have a very short window to actually be able to access this. So who can attend training? I think I briefly covered this. So it's really for the Commonwealth Home Support Program and the Home and Community Care Program for younger people. These are the two service or organisations that actually, or those delivering these services, the organisations delivering these services are able to access this training. And as I also said, it targets a very diverse number of job roles. So the training will focus on a range of key priority areas, and that's embedding a wellness, person-centred, person and family-centred capacity building and restorative care approach, respond to the changing service delivery model and changing populations, and to develop a skilled workforce to meet the needs of the CHSP and HAC-PYP populations. So these are the priority areas, and these certainly are also, when you actually access the website for training, these are up against the themes that have been developed as those priorities. Person-centred wellness and restorative care approach, working effectively with diverse social and cultural groups, understanding of common health conditions, social and emotional wellbeing, and skills and knowledge relevant to change management. And that is in actual fact a new component of the training that we're delivering, and that is very much acknowledging the reforms that the sector has been going through over recent times and continuing into the future. So the training topics. So the training service is offering a range of education training applicable to national units of competency, and these courses have been aligned to a number of competency units. Particularly from the Community Services Training Package and the Health Training Packages. Also, the training is fully funded, so it is free of charge for you and your staff to attend this training. So targeting workforce training needs. So the topic will vary depending on the target audience, and again that's based on those things that I previously mentioned to you. But what are ways to identify your organisational training priorities and needs? So you can review the results of your home care standards when either the Australian Aged Care Quality Agency did your review recently or previous reviews that you have undertaken. And that may be one way of identifying what some of the training needs your organisation may need. It's also, you could review the planning cycle of the wellness and reablement and diversity reports that you would have recently been required to do. So that also is one way of identifying what your organisation may need in terms of training. Also another number of staff informal and formal discussions, plus your organisational plans and vision. That may also be very useful in terms of you really being able to target what are some of the needs that you may have around that training. So around training participation, you are strongly encouraged to actively promote and encourage your staff to attend training by support roster changes of direct care staff and maybe factoring in release time or planning for opportunities like a professional development day, promote training on offer at team meetings, informal meetings, discussions, staff newsletter, email, telephone contacts, Just some ways that you might consider ensuring that your staff actually are aware of this training and that you can actually support them in facilitating attendance. So also in terms of employee obligation to provide professional development for your staff, this can certainly meet those needs too. And certainly ensures staff have skills and knowledge to undertake their work role and provides opportunities to enhance those existing skills. And it also adds impacts like improving potential client outcomes. It does promote a culture of continuous improvement and employee engagement. The organisation can actually become a learning environment. And also it does provide evidence of professional development against the home care standards and into the future, the new single quality standards. And also in terms of the reforms, it actually provides opportunity for market contestability into the future, so you actually have a skilled and qualified workforce. What the training service won't deliver is these 4 key areas, which is management skills, staff supervision, finance, project management, team building, submission writing, evaluation, administrative and related skills, computer software training, report writing, presentation skills, case notes, record keeping and time management, employee related training, induction, first aid, CPR, OC health and safety, policies and procedures, complaints and emergency procedures. And it also doesn't provide maintaining registration with professional bodies. That's all I have to say on this at the moment, but I'll pass over to Lisa Dean, who's representing Swinburne University of Technology, and as Swinburne is our key provider of this service. But the important thing to note is this web address, and that's access to the training service. So I suggest that you download this, put it onto your favourite app so that you are able to access it in a timely way. Thank you.